Hello, everyone. I see we already have some people in the room. If you can hear me, would someone just say so in the chat, please? Can you guys hear me? Yes. Okay, so we will get started. Hi, everyone. I see there are people still coming into the room. Happy Friday. This is Dr. Watkins here, coming live from Phoenix, Arizona at Living Wellness Medical Center. Today is a hot topic. June is the Alzheimer's and Brain Health Awareness Month. So I really wanted to put a slide set together to talk about the naturopathic approach to preventing cognitive decline. Someone says they can't hear me. Someone says they can. Let's try this again. No. What about now? Now you can? Okay, great. Okay, loud and clear. Awesome. Oh, I see my dad's here. Hi. So, I'm Dr. Watkins. I'll start over. I'm Dr. Watkins here in Phoenix, Arizona at Living Wellness Medical Center. And June is the Alzheimer's and Brain Health Awareness Month. So I wanted to do a quick slide set to talk about the way that I approach cognitive decline and kind of trying to prevent this from happening in some of my patients. This isn't something that I was really intentional about treating once I graduated medical school. You know, as a naturopathic doctor, we get trained to treat almost anything, or at least be able to take a stab at it. But it wasn't until I started practicing that I started to notice that there are so many things that we can do now to prevent the decline as we age, especially if there's a family history and there's other risk factors. So I just wanted to share my knowledge and to bring awareness to this topic. It's never too late to start to prevent disease or at least halt the progression of disease. So let's dive right in. So, like I mentioned before, June, this is the awareness month that we talk about brain health and how we can bring awareness to preventing it, treating it, and what we can do for future generations after us, and decreasing the numbers that we're seeing. We're starting to see more and more people present with types of dementia or cognitive decline earlier in life. And we'll talk about why that could be happening and what are some ways that we can mitigate it on our own terms. So, dementia is an umbrella term. When you hear this term, it doesn't specifically mean one condition. There are several conditions that fall within this. The most popular being Alzheimer's. Parkinson's is another one that's really popular, MS. Um, it can be related to alcohol, to drug use. It can be categorized for parts in the brain that are affected, like the frontal area or the temporal area. We can have vascular dementia, which is an also really common form of dementia. Genetic predispositions, infections that can cause dementia, and so forth. I want to talk about the vascular one a little bit more. It isn't as popular as Parkinson's or Alzheimer's, but is common because we see a lot of vascular conditions with our lifestyle here in the West. And a lot of those vascular conditions are hypertension, so high blood pressure, diabetes, hyperlipidemia, having elevated cholesterol, all of the kidney disease, all of these involve vessels, which are a part of the vascular system. In every part of our body, we have vessels that shunt blood to those areas. So if the vessels, the pipes, the highways that get the blood to those areas are damaged, then you don't get that function. You don't get the support that you would need to regenerate those areas and those cells. And that's when we start to see decline, inflammation, and even atrophy. But yeah, I wanted to show that dementia is an umbrella term. there's a lot of things that can fall within that. And we're mostly going to be talking about Alzheimer's today because it is the most popular. It is the one that people are most familiar with. This next slide here is just giving you some anatomy. I like to show these visuals so that you guys have an idea of what's actually happening pathologically to the tissues in the brain. So up here on my left at the very top, the substantia nigra, this is a part of the brain that's really important for dopamine. Dopamine is released from this part of the brain, and dopamine is important for some of our emotional regulation, our cognitive function, so being able to recall names and faces, dates, places, our memory, that sharpness that we have, being able to organize and stay focused, concentrated. It's also really important in our movements. So making coordinated movements like walking or dancing or cooking or writing. That's why we see in Parkinson's disease, the movement is really a characteristic symptom in diagnosing. Those people start to lose some of their movement and some of their control. And it's primarily because this part of the brain is affected. So as you can see, it should be the dark line. That's why it has that word nigra at the end, which is Latin for dark or black. In Parkinson's disease, particularly, that line starts to diminish. We start to lose that dopamine. And you can see on the second picture here at the bottom, this is giving us a closer idea of what's happening to the neurons and the vessels. Up at the top, you see that they're all connected. They're normal. Blood and neurotransmitters can go to and fro easily. But in Parkinson's disease, we start to see that some of these branches are not connected anymore. They are also inflamed. So that's where we start to see some of that decline. This next one here, we're looking at neurons. So neurons are just our cellular pathway measures. They're a type of biological cell that are other neurological cells. They talk through neurons, right? So when we have healthy neurons, our brain can send messages to our body to do things, and then our body can send messages back to our brain to give it that feedback. I like to give the example of touching your hand on a hot stove. Whenever you touch the stove, your body has a signal, which is the burn, which goes to the brain really quickly, and it says, this is really hot. And then the brain sends it back to your body to tell yourself to move your hand from this hot surface. All of this communication is important because of the neurons. So if the neurons are not intact, then you don't have that communication anymore. So it won't only affect your physical body, but it'll mostly affect your neurologic body, so your mind, how you think and how you exist in the world through your mental status. Plaques are really common. So plaques, they're mostly buildup of proteins, and we'll talk about a specific type called Lewy bodies. They build up in the brain and they cause inflammation to the neurons. We also have tangles. So instead of the neurons being like beautiful branches where they can reach all the parts that they need to go, they start to get tangled up and kind of squinched together. They're not in that elongated shape. So those messages, again, are not transmitted properly from the body to the brain, from the brain to the body. I really like these images. It helps to really get a grasp of the changes that we see. This is another really great image. So on my left here, on the normal brain, you see how thick it is. You see how beautiful this structure is. All the tissues are nice and healthy. We have a plane here where you can actually see some of the ventricles, and they don't look too big. They look exactly like what they are supposed to look like. But on the other side, in a diseased brain, you start to see that the brain has atrophied here. So these tissues are not what they used to be. You can see more spaces between the tissue. And when we go to this side plane, you see the ventricles, which are these holes right there in the middle slide. They're much larger. This is coming from inflammation. This is coming from deterioration, and this is coming from the atrophy. So you can see very clearly what a healthy brain looks like in contrast to a non-healthy brain or a brain that's gone through dementia. This is why dementia can be so severe and so heartbreaking when you see it, because it can be very progressive, and it can be very aggressive in the way that it presents. So here are some of those proteins that we were talking about, some of those plaques. So Lewy bodies, they're in the neurons of the brain. So some of those highways, those chemical messengers, that structure, they make a home in that spot. And whenever they clump in the brain, they cause issues because you don't have that nice flow of communication anymore. This can affect your movement, your memory, your mood, and your behavior, just keeping you away from doing your everyday tasks. So you'll hear that a lot, especially with Alzheimer's. You'll hear that term Lewy bodies. This is what we look for whenever you go through more diagnostic testing. If your doctor may think that you may be leaning that way, you'll see a neurologist. They'll do some testing, some imaging. They're looking for these deposits in the brain, these proteins. All right, what are some early signs? So this is a hot question I get from a lot of my patients. I have some patients who struggle with some memory loss as they get older. Even some of my mid-age patients who are having some memory loss. And the first thing they think about is dementias. Am I going into that realm now? Is that what's happening? And we'll talk about other reasons why memory can start to lapse, but memory is one of the early signs. So again, not being able to recall someone's face. It could be someone, your neighbor that you've lived beside for 25 years. All of a sudden, you have a hard time getting their name up. Forgetting how to get home from the grocery store. These are just examples of true memory loss, not just forgetting like, what did my kid eat last week, or what did we have last dinner, or what year was it that we went on that cruise. I would like to attribute that more to aging and stress, but true memory loss is not remembering things that are a part of your life, that have been a part of your life consistently. So like your neighbor, how to get home, forgetting what you were doing. Like if you were on your way to the grocery store and then you just totally forgot what you were doing and why you were doing it. That's a pretty significant sign. So social withdrawal. So this is kind of outside of that cognitive function. This is behavioral. So isolating yourself from other people, not being able to connect in the ways that you were before, having poor judgment. So making poor decisions that may not be likely for you. So this is where partners and community comes into play, as far as helping people see signs that they may not be able to see themselves. If you have someone that's really social or who likes to be around their family, or someone who makes pretty pragmatic decisions, and all of a sudden there's a really stark change in their personality and their decisions, that can be an early sign that there's something going on neurologically that needs to be addressed. Struggling to communicate, forgetting words, not being able to put a sentence together, changes in your vision, changes in hearing also is another one. The eyes and the ears are connected to the brain. So whenever we see changes in there, we like to check in to make sure everything's all right. Again, confusion of time and place, hard to complete familiar tasks, being able to do something that you've done for 20 years and all of a sudden you can't do those things anymore. That can be a sign. Misplacing belongings. I'm really bad about this personally. I'm always losing my phone. I lose my keys. I lose my AirPods. I think that's from not being present, which we'll talk about. But it can be a really serious symptom or sign when you are around your loved ones and they start to lose everything. Even if it was just a minute ago, they don't remember where they put their watch, or they put their watch in the sugar jar, right? The cell phone's in the refrigerator. Little weird things like that can show that there may be a decline in the brain. And then changes in mood. So these are the top 10 early signs. Obviously, these will vary in range of severity depending on where the person is and depending on other factors in their case. But these are like the top ones that I would say to be mindful of for yourself and for your loved ones. Risk factors. So these are the things that predispose you or increase your risks for developing dementia. So the number one is age. As we age, it's a natural process. Things just don't work the way that they did when you were 12 years old, when you were 22 years old, when you were 35 years, whatever that number is for you. As you age, things change. We are not meant to live forever. It's a natural process. It's a natural life cycle, a life and death cycle that we birth and we grow and then we die and then it happens again. So this is the same cycle that we see in our body. So with aging, we see more of these symptoms. We see more people being diagnosed in their later phases of life. Family history is important, especially if there's an immediate family member, so mom, dad, who has some dementia. It puts you at a higher risk there. So that's something that we look out for. This is why family history is so important to know about and to be able to present to your doctor whenever you guys are going through your case. It can really help us to hone in on things that we may need to give more attention to. Down syndrome increases the risk factors. Diet and exercise. So poor diets that are poor in nutritional value, sedentary lifestyle. And we'll talk about how we can change that and what that looks like moving forward. Vitamin and nutritional deficiencies, which go right into eating a poor diet. Excessive alcohol use. Alcohol can be very, very inflammatory to the brain, specifically. Smoking, air pollution, head trauma is a really obvious one. So football players, we see this a lot. Boxers, fighters, like mixed martial art fighters, patients who have had significant motor vehicle accidents or falls. This puts them at a higher risk. Cardiovascular risk. This one is really important because I see this a lot in the United States. HTH should be HTN, which stands for hypertension, high blood pressure, cholesterol, elevated lipids, and atherosclerosis and diabetes. Again, all of these conditions, these chronic conditions, affect your vessels, which affect your brain and your heart. Those are very closely connected to each other. So you'll hear me say that over and over again. And if you have a naturopathic doctor, I'm sure you're familiar with hearing that from them too. Depression that is onset later in life is a risk factor. You know, we talked about some of those 10 signs for early dementia, and depression and mood changes is one of those things. So if you have someone who has a sunny disposition, they've been that way all their life, and later life they get more depressed, that could be a risk factor. It could also just be the burdens of life too. So knowing how to differentiate that, and again, having good communication so that we can really identify what's happening is helpful. And then medication, so sedatives, sleeping aids like a Tylenol PM, a Aleve PM. There's some over-the-counter medicines like antihistamines or allergy medications. There's some research that shows with overuse or long-term use of those, it can affect the way that your brain works. Also, psych meds, so meds for mood, anxiety, depression, bipolar disease. We'll talk about those in details later, but those are some other ones that put you at a higher risk. It's a long list here. Okay, so the bread and butter right here. This is the naturopathic approach. So these are some of the things that I do whenever I have a patient where we want to prevent this from happening. They have some of those risk factors, or even they don't have those risk factors. They just want to be proactive in preventing this from happening in their older age. These are some things that I look at. One is inflammation, addressing nutrition, prioritizing sleep, prioritizing movement, stress management, medications. And what I mean by that is monitoring medications, managing them appropriately, recreational drug use, encouraging hobbies and activity, and cultivating a sense of community and community around the affected person. All right. Addressing inflammation. So, inflammation is like the crux of every chronic disease. You will always, always, always hear this word when you think about chronic diseases because it is the root to almost everything that we see, especially in naturopathic medicine. This is what we like to address as a priority, like priority number one. So, in context for the brain, drug and alcohol abuse. So these are two exogenous factors from the outside world that really affect the brain and increase inflammation. Now, alcohol itself isn't terrible. There's some research that shows that wet red wine can actually be protective of the brain. And we'll talk about that a little bit later when we dive deeper into the nutrition piece. And it's partially because of the antioxidant status that we see in wine. However, you need to make sure that it's coming from organic grapes and that those grapes have not been sprayed with pesticides and herbicides, that they've been cultivated in a really clean way, so that you get a nice quality alcohol. But binge drinking, overuse of alcohol, that definitely causes inflammation. Drug use changes the brain chemistry in the brain, which can cause inflammation. Smoking is so terrible for our bodies. It increases free radicals, and free radicals are the agents that cause inflammation. They're basically these overactive, what's the word I'm looking for? Um, they're like overactive atoms that cause inflammation. They're like cells that have gone haywire, and they cause other cells to become unhealthy. And smoking is like the quickest way that you can increase that happening in your body. Stress causes a lot of inflammation. This is a hard one because stress can be tangible. It also can be intangible. We talk about stress a lot with naturopathic medicine, but it can be really hard to address in a stressful world that we live in. Saturated fats, which we get primarily from animal products and meats, can cause inflammation, especially if that meat is not a clean source, like having grass-fed, grass-finished beef, wild-caught fish versus farmed fish, that type thing. Trauma. So again, trauma to the area. If there's been injury to the brain from falls or other sports or accidents, that can cause inflammation in the brain. Systemic inflammation, so inflammation that we have throughout the body. Diabetes, if there's any autoimmunity happening, like lupus or Hashimoto's, Graves' disease, rheumatoid arthritis, just to name a few. If it's happening in your body elsewhere, it's happening up here too, because your body is connected. It's the sum of all of its parts. They're not separate. And then having a poor antioxidant status. So again, this is where the diet piece comes in. If you're not getting those antioxidants from your food, or you're not getting them from supplementation, you don't have that protective support from the free radicals that the smoking causes, that the saturated fats cause, that the alcohol and the drug abuse can cause. So we like to attack the systemic inflammation as a way of attacking neurologic inflammation. Having poor circulation. So again, that vascularity coming up again, we need to make sure that we can get blood and we can get oxygen to the organs and the cells. What does this look like? Someone who lacks exercise or has a sedentary lifestyle, there will be poor circulation. This is why exercise is so important. It keeps the lymph, it keeps the blood flow moving so that it can get to where it needs to go. Heart failure. Again, heart cannot pump effectively, so you don't get that blood supply. Respiratory issues, the oxygen exchange isn't happening. Anemia, so not having enough of the iron in the red blood cells or not having enough of the red blood cells to transport blood. Peripheral artery disease, I see this a lot with my diabetic patients. I also see it a lot with my cardiovascular patients. So this is where not only are the arteries in the heart affected, but arteries elsewhere are affected. And then diabetes, which is it really plays a number on the vessels, and it's so common here in the United States. So whenever I have a patient that has diabetes, I always like to push to them. The reason why we want to get a handle on this is because it doesn't just affect your sugar; it affects every cell in your body, which makes it more important for us to try to prevent it and for us to be aggressive when we're treating it. And then environmental pollutants, especially air pollution. Harvard has done so much research on air pollution and how that affects cognitive decline and dementia. And the research is pretty disheartening. Air pollution isn't something that one person can fix. It has to happen from a societal standpoint. But there is a lot of research that shows that if you live in an area where there's more air pollution, Phoenix is one of them, unfortunately, or you live close to a highway or other industrial plants, you could be at a higher risk for developing dementia because of that inflammation piece. Now we're going to go into nutrition, which is so fun for me to talk about as a naturopath. There's so much we can do nutrition wise in protecting the brain and just protecting your body as a whole. The first thing that we'll talk about is antioxidants. This might single-handedly be one of the most important nutritional pieces whenever we talk about brain function. Antioxidants are so important. And if you think about the name, antioxidant, so oxidation is what happens when free radicals are doing their thing. Free radicals, again, are those atoms in those cells that are causing inflammation. Antioxidants are stopping that. Okay, it's the anti of oxidation, which is why it's so important in the brain. This is also why when you hear eat the rainbow, this is why it's important to eat the rainbow, because those foods that have that vibrancy and the color, those are the ones that you're going to get most of your antioxidants from, which can protect you in your brain, your heart, your muscles, your skeletal tissue, et cetera, et cetera. Beta carotene is really popular. Lycopene, which we get from foods that have a red hue to them, like tomatoes or guava. Selenium, we find a lot of selenium in shellfish, fish, and Brazil nuts. Selenium is also really important for the thyroid, particularly for people who have hypothyroidism. Selenium is one of those cofactors that we need to convert our free hormones in the body. Vitamin A, C, and E are also very important. We get those from sweet potatoes, lemons, limes, nuts, seeds, carrots. Vitamin C is a water-soluble vitamin. So that's something that you need to be putting into your body often because you're going to be eliminating it quickly. So these are not foods that you can just eat once a day and think that, or once a week, and think that you're going to get some benefit from it. You have to really integrate this into your lifestyle, into your daily diet. So you get a little bit every day, and over time, that really adds up for you. Resveratrol, which is also a polyphenol. These are our like reds, our purples and our blues. So these are the ones that we find in berries, skins of red grapes, blueberries, cranberries, the wine, and even some peanuts for our patients that can have peanuts. Alfalfa sprouts, cherries, eggplant, the skin, dark vegetables. These are all foods that are really high in antioxidants. I always tell my patients, out of all of the fruits, eat as many berries as you want. As long as they're organic, I don't have a problem with my patients using that as like their fruit of choice because it's low in glycemic. It's a low glycemic food, which means that it doesn't have a lot of sugar that can cause your blood sugar to spike. It isn't like a banana or a mango or a pineapple, which are extra yummy but have a lot of sugar. Berries have fiber. They also have the antioxidants and they're low in sugar. So I'm always like, go ham on the berries. If you want the berries, do it. Organic if you can get it though. So that's our antioxidant piece. This is probably one of the most important parts of the diet that we'll talk about. Fatty acids are also important. So fatty acids, particularly omega-3s, are important because they help with the cellular structure. So our cells have this phospholipid bilayer. They have this like fatty coating that keeps them protected. It keeps their shape nice so that they can move around in the body and communicate with different parts of the body in an effective way. We need that fat for the cells to be optimal. And one of the best ways that you can get this is through fish. This is why we really push fish oil, myself included. If I have a patient that can tolerate fish oil, it doesn't matter what we're treating. That's just going to be a part of the plan because it is so good at giving us those fatty acids that protect the cells. It also protects some of the meninges in the brain. So again, the structure of the brain. I like to tell my patients to try to get wild caught fish if they like it 2 to 3 times a week. It's really important that the fish is wild. Whenever we have farmed fish, those fish, they are confined in a small area. They're usually fed with grains that have been genetically modified. And then when they have their waste, they swim around in their waste and they reabsorb that waste, which means that you reabsorb it when you eat those fish. So wild caught fish is better for you nutritionally, and it can give you more of those fatty acids in a clean way. Olive oil, avocados, and algae are some other alternatives that you can get it. For me personally, I have a fish and a shellfish allergy. So I don't really even play around with the fish oil. I just go right to the algae as a supplement. It isn't nearly as high or as potent as the fish oil, but it's something. So there's another alternative for people who can't tolerate fish or shellfish. Seeds and nuts are another great way to get those in. So saturated fats, we want to decrease saturated fats. Saturated fats increase the production of free radicals, which we talked about. Saturated fats are found primarily milk, cheese, or meat. This is not me bashing meat. I am a meat eater myself, but it's important that we have a well-rounded diet, and it's important that we're getting healthy cuts of meat. I don't like to generalize and say that all saturated fats are bad, because we need fats, we need cholesterol to make our hormones. They're important. Instead of focusing on macronutrients, I like to look at the diet as a whole. I don't want to single any one part of the diet out, because you have to think about accessibility for patients. What do they have around them? What can they afford? And what do they eat culturally, right? I think it is easier for patients to make changes in their diet when you really understand how they're already eating, what's important to them as far as culturally and in their community, what they can afford, what they have access to. So then they don't feel like you're taking things away. We are just beefing up or making their diet better. We're not necessarily taking everything away. So saturated fats, I like to keep it on the low side, and if you're going to have it, making sure you have good qualities. Refined sugar. Sugar is sugar is the no-no in most, if not every, condition. Sugar is highly inflammatory. Sugar completely hijacks your hormonal system. The more you have it, the more you'll crave it. The harder it'll be for you to get away from it. What does refined sugars look like? So table sugar, powdered sugar, high fructose corn syrup, which is in everything, by the way. Brown sugar, date sugar. And keep in mind, like, date sugar is a natural source of sugar. It's still sugar. Don't let that fool you. Malt syrup, rice syrup, agave syrup, refined honey, not raw honey, but refined honey, and fruit juice. A little bit of sugar here and there is not going to kill you. I think living a life that you feel good living and having some fulfillment from your food is important. But again, everything in moderation. That's how I like to look at the diet. So, for my patients who eat a lot of sugar, I try to isolate, where are you getting most of your sugar? In what meal or in what type of food are you getting it? How can we just decrease that weekly intake to then eventually create a bigger change? So I see a lot of patients who love fruit. We talked about berries a little bit earlier, and I like fruit. Fruit is like our natural form of sugar and our natural candy, as I like to call it. But fruit can be detrimental, especially if diabetes is on board, if there's a family history there, if there's a sedentary lifestyle, so we're not working out, we're not having a balanced diet elsewhere. That's when it becomes problematic. So I like to keep refined sugars on the low side, just as a basis thing. So then I don't have to worry about it as much. Just don't buy it. Don't put it in your house, because then you're going to be fighting. You're going to be fighting with yourself. But yeah, sugar is a big culprit for the body. Now, switching gears out of nutrition into sleep. I love talking about sleep. I love sleeping. It is so important. I feel that if I wanted to, I could build a practice on sleep, because we get so little sleep here in the West and we work so hard. I really think this is why we're seeing more chronic conditions. This is why our children are being diagnosed with more behavioral conditions, because they're not getting enough sleep. We all are not getting enough sleep. And we'll talk about what that looks like. Sleep depth. So Dr. Turner, one of my mentors, she always talks about a sleep debt. And I think this is a really good way to kind of outline and get an idea of how to think about sleep. So there's a lot of studies that say that 7 to 9 hours for a full grown adult, so 18 on up, is usually what most people need. Now, this will vary between person to person, but I usually like to say no less than 7 hours and up to 9. If you need more than that, if you're one of those people who need 10 hours of sleep, that's just what your need is, and that's okay. But figuring out the sleep debt is knowing like how much sleep do you need minus how much sleep do you actually get. So if I know that I need 8 hours of sleep a night, but I'm only getting 6 hours, that means that every night that I'm getting that 6 hours, I'm going into debt more and more and more by 2 hours. And over time, this adds up. We start to see this in thyroid issues, adrenal fatigue, exhaustion, mood will be off, hormones will be off. Sleep is so important. So understanding what your need is, how much you're actually getting, and then addressing that so that you can get more of what you need. He looks so peaceful. Quantity and quality. So this is important. How much sleep you get is important. How good of the sleep is important. So if you only get 6 hours of sleep, but that is restorative sleep and that's all you can get right now, sometimes you just have to rock out with that. I see this a lot in my mothers, especially with younger children. The days of getting 7, 8, 9 hours of sleep may be long behind them unless they have a lot of help. And that's just something that they can't change right now. But if we can prioritize getting good quality of sleep, so even if it is 6 hours or 5 hours, making sure that you're falling asleep easily and that you're staying asleep throughout the night so that you still get some of that restorative benefit is really, really important. So I don't like to put these one over the other. They're both equally important. And this is how I assess my patients with sleeping. How many hours do you get? Are you sleeping throughout the night in those hours? Are you being interrupted? Do you toss and turn when you wake up, or can you go back to sleep easily? Do you toss and turn to fall asleep? Or are you one of those people where their head hits the pillow and they're knocked out? These are all things that I look for so that I can assess where are they having difficulties with sleep? How can we make it better? So, pathways to sleep. Here are some treatment approaches that we do. Sleep hygiene and ritual. This is so important. We don't give ourselves enough time to cut off between being on and then being off at the end of the day. We work so much here in the United States, and we really don't know how to go into that parasympathetic, that rest and digest part of our lives, versus staying in the sympathetic, which is fight or flight, like the go, 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 the grind mode. We just don't prioritize that here. And so creating a safe space for yourself. And I like to call it a ritual because I think sleep is sacred. I really do. Is important so that you can do self-care in that way and you can stand up for yourself in that way, right? So sleep hygiene, this ties into screen time or blue light. So we don't want to be on our iPad or our computer or our phone until the very minute that we go to sleep. One, because the brain's stimulated, right? Because you're doing things with technology. But two, because it's stimulated through the blue light. The blue light that we get through our devices inhibits our hormones from being released. That tells our bodies to go to sleep, right? We have a natural rhythm in our bodies. When the sun is up, we wake up. When the sun starts to go down, we start to go down, or at least that was the natural design. Now we can totally flip that. I see this in my nurses. I see this in our flight attendants, people who work the night shift. As humans, we've adapted to where we can work at night and then sleep in the day, and that can cause things to be off. Either way, whatever your schedule is, just creating a boundary of like, this is what I do for myself every night to tell my body that we're about to rest is important. So cutting off the blue light or the technology at least 30 minutes before bed. If you can do an hour, that'd be great. Some things that I like to include: journaling, a way to kind of brain dump your thoughts from the day so that you don't bring that back into your dreams and you can kind of release all the things that you accumulate throughout the day. Drinking tea is a great way. And this is how we bring in botanical medicine, which is here on the list. Things like chamomile, or kava or passiflora can be very helpful, and getting that in a tea form can be very soothing, because there's like a ritualistic aspect to making your tea, right? I have my favorite cup that I like. That's like my nighttime cup. I let my water boil slowly so that, again, I'm not rushing. I'm not getting a cup and then putting it into the microwave and zapping it for 2 minutes and then putting a tea and then getting back in my bed and like being on my phone. That defeats the purpose, right? I'm doing things slowly so that my body's already getting those cues from my behavior that it's time to go to sleep. Um, What's another thing? Epsom salt baths before bed can be really great. I like Epsom salt because it's just magnesium. It's magnesium sulfate, which is a muscle relaxant. So you absorb that through your skin, which helps your body to relax. You also can't do a lot of moving in the bathtub. You just got to sit there. And I think we don't sit enough. So that can be helpful. If you don't like baths, I like doing showers and then ending those showers on cold, which can be very soothing to the body. Doing light stretching, yoga nidra is really great. Yoga nidra is almost like sleep yoga. It's like a meditative yoga, meditating, praying before bed, doing yin yoga, just doing some gentle stretching, which you can do in your bed. You don't need 30 minutes to do a small routine for yourself. You can do it in like 5 to 10 minutes. YouTube has millions of videos of like in bed, before bed yoga, that can really help your body to kind of turn off. Neurotransmitters and amino acids. So this is another way that we can kind of push the brain to go into that rest and digest phase. So things like L-theanine, glycine, magnesium isn't either one of these, but it is kind of put in that category. So magnesium glycinate can be really helpful. Um, uh, Pharma-GABA is a neurotransmitter that then, again, pushes you into that rest and digest phase. Botanical medicine, which we talked about. So this can be in the form of a supplement. This can be in the form of a tincture. It can be in the form of essential oil. So lavender oil, putting that in your bathtub, rubbing some of that on your skin behind your ears as you're starting to go to bed can be really helpful. And you can also get it in a tea form. Acupuncture is great for people who have difficulties with sleep. I just love acupuncture. Acupuncture is one of my like magical tools for my patients because it's an energetic medicine. It goes deeper than what we can see with our eyes. It's not like me adjusting you physically. It's not like me giving you hormones or treating your diet or giving you supplements. It goes deeper than that, and sometimes we need to address things a bit deeper to create real change. So I like acupuncture for that reason, because it is gentle but it's powerful. And then hormonal balancing for my women, especially around perimenopause and even postmenopause, we lose progesterone, and progesterone is one of the most important hormones that help our body to be able to regulate from that fight or flight into that rest and digest stage. This helps us to be more calm. This helps to keep our moods more stable, and it helps to get us more restful sleep. And I say peri and postmenopausal women, but I have a lot of women who are in their really fertile years, and even women who are younger than that, 16, 18 years old. And I'm starting to see that progesterone is low in even those girls. So, assessing all of these, that's the great thing with naturopathic medicine, is that we can individualize this to what's reasonable for you and what you really need. It could be one of these things. It could be a mix of all of these things. But this is how I address sleep. Stress management. So again, stress is one of those things that's really hard to talk about. It isn't like weight gain where you can see if you've gained 15 pounds, with stress, sometimes we don't necessarily see it on our body. Sometimes we don't even feel it because we're so used to being in that rut, right? So it's hard to get patients to reconcile with their stress if they don't even acknowledge or see the ways that they're stressed. It's also hard because we live in a stressful world where we're always working. Regardless of where you fall on the political spectrum, through politics and social climate, environmental climate, financial changes that are happening. A lot is happening in our world right now and has been. So um, it's impossible to live a stress-free life. So instead of going that route where we say, we want to cut all your stress or stop stressing, that's not helpful to patients because that's just a part of the human experience. Instead, I want to change your response to stress, right? I always tell my patients, I can't take your stress away, but I can help the way that you respond to the stress that you do have. And some of those ways are through organization, attitude or mindset and acceptance. So organization is important because if you're a busy person, and I'm sure all of you are, we need boundaries and structure so that we can see where we are, where we want to go, and how we want to get there. My favorite way to do that is by having a notebook. I have notebooks around my house. I have one in my car. I have one in um, my bathroom. So when I'm in the bathtub and I have a thought, I can just grab it. I have one that I have at work. I have one that I have near my bed. And this is just a way that I can get my thoughts out and I can organize my thoughts so that when I'm feeling overwhelmed, I know that I have a plan. You know, I have a list of things that I need to do and deadlines that I need to do them by. And that helps me to manage my own stress. Attitude is important. So, how you have a look on the world and your perspective on your life is important, right? If we think positively, our world becomes more positive. It doesn't mean that it's going to be unicorns and ice cream all the time, but we have to take accountability that the way that we view the world can shape our experiences. So this is where mindfulness and meditation comes into play. Also acceptance. So again, knowing that no one lives a stress-free life. It's impossible. We can never predict what's going to happen in life. The only constant in life is change. And we have to get to a place to where we can accept that. And that in itself will help you manage your stress because you don't hold on as much. You're not trying to control as much. Instead, you're just living in the flow and doing what you can and letting go of the things that you can't change. Mindfulness, meditation, prayer are all really helpful because they take you to that quiet place. They bring you into that introspective place to help you make sense of things that you're going through in your life, which is really good for the brain. And exercise and movement, which is also very good, mostly because of the vascularity, right? The more that we move, the more that we're flexible, the more that we're in tune with our body, the better our bodies will operate. The more blood that can be shunted from the back to the brain, the better your brain will work. This is also a great way to relieve stress because it gives you an outlet to get things out, right? For you to burn out that energy. If you have stagnancy because you've been at your desk all day, go for a walk in the parking lot, take the stairs instead of the elevator. There's always easy ways to move and to get more movement in your life. And this is really, really important for the body as you age. Medication. So these are some of the medications that research has shown increases your risk sometimes by tenfold for dementia, which is really disheartening because there are so many people in the world who are on these. So antidepressants, antipsychotics, anti-epileptic drugs for our patients who have seizures, and then anti-muscarinic drugs. And these are drugs for people who have like overactive bladder. So if you have these conditions where you need this medication, this isn't to shame you. It's just to bring more awareness that if you need these, then that means that we need to be doing other things as far as the stress management, the sleep, the nutrition, to make sure that we're protecting you on that back end while you're treating whatever the condition is with these medications. What makes these medications risky for the brain is that they change brain chemistry. That's what they're supposed to do. They change brain chemistry. They bind to certain receptors so that your other hormones can't bind. And they can even cause some overactivity, which over time, your brain isn't working in the way that it would naturally. It has a false or an artificial way of being because of the drugs. The drugs are causing certain actions. And again, if you need those for your mood, it is what it is, but we can do other things to protect you. Whenever I have patients who are on these drugs, I like to get a really clear history of when did these changes in mood or behavior start? What was happening in your life when they started? So I'll give you an example, depression. Oh, I started being depressed in 2012. what happened in 2012. We go back there and we try to see if there's any pieces there. What happened in your personal life, your financial life, your emotional life, your environment? Was there a big change there? What things have you tried other than medications? Whether that's over the counter or herbs or therapy or movement. Getting an idea of what has worked in the past, what hasn't worked. And so then, if you are one of those patients where we're at a place where we can start to wean you from these medications, we can still support you and really understand where you are. Now, obviously, something like an antipsychotic or anti-epileptic, those are not drugs that we would be, quick to try to wean you off of because they are very serious, and depression is serious too. But I've had really good success with naturopathic medicine on helping. If we can't take the medication away, we can at least wean it down to where they're getting less of those nasty side effects, and we can do other natural stuff to support them in the meantime. Drug use, so recreational drug use. So similarly to pharmaceutical grade medications, recreational drug uses also changes brain chemistry. That's why we have those psychoactive effects. When you feel high or have the hallucinations or the delusions from doing certain drugs, this can be harmful to the brain over time. Your body stops producing neurotransmitters that you need because they've been shunted because you're having drugs coming in from another spot, right? You're having another drug come in that's binding to receptors and causing an action versus your brain doing that action naturally. And over time, when you take those drugs away, if you can take them away, if there's not a dependency there, you start to notice that your mood may change, your behavior may change because you're just not getting that cellular firing that you had before because it's been damaged from the drug use. So I like to educate my patients on what their drug use is, how much they're using it, why they're using it, and then go from there. Another way to address dementia, hobbies and activities. This may be, just as important as diet. There's so much research that shows that having a patient or an individual be active, whether that's physically or with their brain or with their body, it can really help the brain because the brain is stimulated to work, right? Dancing, there's so much research about dancing out there for cognitive decline, and that is personally one of my favorites. It's such an amazing stress relief. You get a lot of endorphins when you move your body to a song that you like. It's the way that you can have fun. It's the way that you can connect with your body and just express yourself and release. I love when I see group classes for my older patients where they can have a partner and dance with different people and learn dance steps and choreography because that triggers the brain. Your brain has to remember what those steps are, and then your brain has to communicate to your feet how to do those steps. And doing that over and over and over and over again, it not only increases your rhythm, hey, but it helps with that brain and mental connection. You re-solidify those neural connections because you're keeping your body and your brain active together. They're working together. Doing artistic things, so sewing or crocheting, doing pottery, painting, collages, quilting, any way where you can create and express yourself is going to be really healthy for the brain because, again, you are thinking, but you're thinking in a different way. You're accessing another part of your brain. I also think it's just good for us spiritually because this is the way that we can express ourselves. And I found that in our world, we don't express ourselves enough. So art is a really good way for you to do that without judgment. Riding a bike can be great, if your body will allow it. Cooking is another great way because you have to think when you're cooking, right? Especially if there's recipes. So again, you're using your brain and your body and your hands to make something. Fishing, jump roping, one person's carving here, singing. So just having a hobby or an activity that you like. Just because you get older doesn't mean that you have to stop living your life. And even for my patients who are not older, like if you have a hobby, hold on to it. It's important for us as humans to continue to grow and explore and expand ourselves. Try something new. Get a friend with you to try something that you guys have never tried before. You may be surprised at what you find. And it's a really easy way to protect your brain without it being so clinical. And then the last part of this is community. So, community is so important for patients with dementia because it is very isolating. These patients, eventually, if it gets bad enough, they forget family members, they forget friends, they forget where they are, they forget who they are. And that can be very frightening. It's very isolating, it's very lonely. And even before you get to that place, right? If you are isolated and you don't have a sense of community around you, that affects you spiritually. It also affects you mentally. It causes more stress. You don't have that social interaction that is really helpful and healthy for humans to have, which can then predispose you moving on, right? We don't have to wait until we're older to like see that we need community. We need community throughout our lives. As humans, we were built for community. Um, so this is something that I really, really encourage. And community can look so different. It doesn't have to be the family that you were born into. It can be your friends. It can be your neighbors. You can have a work community. And with the internet, building community has become so easy. There's meetups where you can find a group of people who are into like the one thing that you're into. If you're into Star Wars, you can find a group of people who are into Star Wars and you can bond over that. If you're into salsa dancing, you can find a salsa community and you can bond over that. If you're into cooking or gardening or reading books or whatever that thing is, the internet has made it really easy for us to cultivate this sense of community so that you feel that you're a part of something, you feel supported. And that's overall really good for your brain and your behavior and your mood. So, yeah, that's really all that I have for you here. As always, as a naturopathic physician, we like to go through our principles, identifying the root cause, treating the whole person, the healing power of nature, understanding what's really happening with the person, because you may have one of these pieces. You may not have any of them, right? You may need all of them. It can look so different for each person. So having a multifaceted approach is really helpful when we talk about these topics. So then we can really individualize it. We can make it fun. We can make it less scary. There's always something that we can do to help your body help itself. So I will open up the floor for questions here. If any of you guys have any questions or feedback, please put it in the chat box, and I'll give us a couple of minutes for us to go through those. No, you're so welcome. Any questions? You all should be experts in approaching dementia now. We talked about a lot of tools here. I hope it was helpful for you all and that you were able to have some benefit from this conversation. It's always so fun for me to share my experience and to share what I know with other people. Oh, you're welcome. All right, guys. Well, if that's all, we will end the webinar now. It was so nice to share this space with you. We'll be doing some more webinars throughout the year and next year, so keep an eye out for our newsletter. I do want to remind everyone who are not patients, I do a free 10-minute meet and greet where if you want to come on as a patient, this is an opportunity for you to express some of your health concerns and for me to kind of give you an approach on what I would do in that situation and then see if we're a good fit for each other. Oh, hi. How accurate are apps for sleep watches tracking quality sleep? So I don't think the sleep apps are great at treating quality. I think they give you some data because they can pick up when you wake up or when you move, but If you're one of those people who just move a lot, but you still have great sleep, it could be giving you false data. I think it's more helpful in quantifying how much sleep you get. I don't think it's up to like the quality of sleep. You're the one who will be able to identify if you're getting quality of sleep or not, depending on how you feel. So if you get 5 hours of sleep and you wake up and you feel refreshed and you have energy through the day, then you're getting quality sleep. And that may just be your normal for you. If you're getting 9 hours of sleep or 13 hours of sleep and you still need to nap, or you feel groggy when you wake up, or you have a hard time getting on, then you know that you're not getting quality of sleep and something needs to be addressed. That's a great question. This will be available for online reference. So all of our webinars are recorded and then we post them about a week or so after. We also break these webinars up into blog posts, and you can always find that on our website, livingwellnessmedicalcenter.com. And we have a resources link where you can go there and you can find all of this information. Oh, you guys are so sweet. Thank you. All right, friends. Well, until next time, stay hydrated, stay safe, stay happy, and I will see you next time. Bye.